Hey guys, so today I'm going to be talking about sex addiction. I think it's an appropriate topic that can be applied to a lot of the areas we're talking about in this class, and I want to discover more about it, so that's what I'm doing. Another term for sex addiction is hypersexual disorder or compulsive sexual behavior. And upon hearing these words, one might think that this is just a term that can be applied to an individual who has a really high sex drive, high libido, someone who has a wild sex life. But the truth of the matter is that hypersexuality, or as I'll refer to it as sex addiction, shares many of the same exact qualities as other addictions that we see. So just as seen with drug or alcohol or gambling addiction, it takes complete control over an individual's life and the decisions they make. Sex addiction involves intense destruction of a normal life activity, and excessive sexual fantasy and behavior can cause stress among personal relationships, family, friends, as well as social, occupational, and financial areas of life. So there are various types of sex addiction, and it ranges from compulsive and harmful sexual behavior to excessively unhealthy thought process or compulsive sexual fantasies. Some of the different types of sexual addiction that are seen are compulsive masturbation, having multiple amounts of affairs, obsessive dating, excessive use of pornography, cybersex, exhibitionism, which is exposing your body parts at inappropriate times, and voyeurism, which is finding pleasure in others engaging in sexual activity. And also prostitution, just a lot of the things that we see in regards to sexual activity. So all of these types of sex addictions are characterized by the repetitive, compulsive pursuit of risky sexual activities. People who engage in these behaviors do not always acknowledge the social, psychological, and potential physical consequences like STDs and STIs. Again, as seen in other addictions like the drug, the pleasure center of the brain is going through these chemical changes that lead an individual to want more riskier and more excessive intense sex, and they look for that high that comes with these sexual behaviors. So it's estimated that 3 to 6% of adults in the United States suffer from sex addiction, and there is no official clinical diagnosis of sex addiction. I feel a little bit shocked each time I hear this that it is not listed in the DSM, although it is considered a significant mental health problem. There definitely is controversy about this topic among social workers and psychiatrists about whether it should be classified as an addiction, but the American Society for Addiction Medicine does consider sex to be a real addiction, as it matches addiction qualities, including the changes of the neurotransmitters and how the structure of the brain plays an integral role. Many people, however, believe that sex addiction is just a made-up thing and used as an excuse to simplify bad decisions and poor behavior. There is no single known cause for sex addiction, but it is believed that abuse, neglect, and other forms of trauma in childhood is often the root of the problem. Research has found that around 80% of sex addicts suffer from past sexual abuse or emotional trauma. Having traumatic experiences at a young age can lead a person to have deep feelings of unworthiness or disgust about themselves, and sex is something that might be used to numb these feelings. Other reasons for sex addiction could stem from poor parental nurturing or familial support growing up, the absence of learning healthy relationships and boundaries. I personally think it is important to look at sex addiction in a trauma-informed way and know that many of the reasons this addiction occurs is because of past trauma. It's important for us as social workers to recognize that the road to recovery is not that much different than those of other addictions.